Good evening, everyone. Welcome to part 2 of our webinar series, Hiring Home Health Care Aides, sponsored by Cleveland and Woodley Park Village. I'm Frank Finnemore, the Executive Director of Cleveland and Woodley Park Village, and I'm really delighted to host this event, not only for our village, but also for all 13 villages across DC, as well as anyone from the public that might be here joining us. We hope that you find this information useful, and that's why we open this to anyone that was interested. If you're curious about DC villages and want to find your home village, or if you want to start one in a part of the city where we don't yet have a village, you can go to dcvillages.org for more information. We have a very full agenda tonight with 7 home care agencies participating. We're very lucky that they're able to join us. And I'm excited to be hosting the webinar with them because it's a natural partnership. We each have a mission related to helping individuals stay aging in their home where most of us want to age. And we do different things that are also very complementary. Before we get started, there are a few things I'd like to state as a disclaimer. One is I tried to cast a very wide net and invited as many home care agencies as possible to participate. I did concentrate my search for those that serve my village's location in and around Cleveland Park and in Ward 3. If you're joining us from outside this area, in another part of the city or even outside of the city, there may be another agency that also serves your area. And there are certainly other agencies that even serve our area around Cleveland and Woodley Park, but they didn't choose to respond and join us tonight. But we are very happy that we have 7 that did. By showcasing these 7 agencies, I want to let you know that our hope is to give you more information so that you can make informed decisions about the best provider for the services that you may need. And Cleveland Woodley Park Village is not making any recommendation by virtue of featuring these 7 agencies. I've asked all of the agencies to let us know about their ownership, thanks to an astute person who asked me to make sure I asked that of them. So thank you very much. I've asked them to give us a little bit of an overview about their services and sort of what makes them unique, their service requirements, including minimum hours, and their rates. A few other housekeeping items before we begin in earnest. This is being recorded, and we'll make the recording available tomorrow on our website. And our website is www.cwpv.org. And we'll put that in the chat so you don't have to remember that. But as a reminder, session 1, the session that we had with Christine Bitzer from Seabury Resources for the Aging, about what to think about when trying to decide when and how to hire a home care agency, that recording is already on our website. And so you just go to the homepage and then you just scroll down and you can see those resources. Because we have so many participants tonight, we've muted everyone so that you don't inadvertently disrupt the panel as they go through the discussion. And we've allotted each agency 7 minutes to provide you with an overview, and I'm going to try to keep that time. We've received some slides, and we will share those slides not only, of course, during tonight, but we will share them along with the recording, both as part of this recording, but also as a separate document. So you can get those on our website tomorrow. And we will also ensure that the slides have their contact information. So I'll introduce each of the people from the agency. The order is completely random. And I encourage you to use the chat function to log your questions. If it's for a specific agency, please let me know in the chat so I can moderate that discussion. And at about the 8 o'clock hour, we'll move to a Q&A session for the last half hour. And that's when we will all be available to answer any questions that you may have. So with that, I'd like to get started and invite Imran Ahmed and Pam Ernaway from Home Instead to start us off tonight.
Great. Thank you, Frank. It's really nice to be here, first of all. And hello to everyone on the call. My name's Imran Ahmed, and I am the CEO and owner of Home Instead. And it's really nice to be here because, first of all, I've known Frank for almost 2.5 years now. I just wanted to put in a few words about Home Instead. So really, I wanted to use this opportunity to talk a little bit about why we're doing this. So for many people, of course, going through this process is kind of like, you have to learn and you have to really, it's not readily known how this whole process works. And I have firsthand kind of experience going through this. So really, my first experience with home care was when my father fell ill, and this was during like several years back. He had a stroke and he was semi-paralyzed, and really, my parents lived with me for 15 years. And so what happened was, while we were working, my younger brother and elder brother actually moved into my home because my father was semi-paralyzed, and we had to kind of take 8-hour shifts to help him. And eventually we had to reach out to a home care company to kind of help us. And that was the first time that we were exposed to what home care is. And I think the experience that we went through really shapes everything we do at home. Home Instead, for instance, we called like 5 companies and only one actually bothered to call us back. And the one that did said that they couldn't provide the service, but they did something that I've never forgotten. They gave me a number and said, you know what? Call this number, maybe they probably likely to help you. And we did, and we took services, and it was a game changer for my father. Now I have never forgotten that one kindness that agency did, which is even though they couldn't provide service, they pointed us in the right direction. And I think that sets the kind of standard that we have at Home Instead. It doesn't matter that you have called us and whether we can help you or we cannot. What we will definitely do is point you in the right direction, give you the right advice, give you the right material, point you in the journey that ends up basically getting you the help that you need. So that's just some background context. Of course, it's very important to me for us to be able to really help our community where we live. So it's absolutely essential to understand that when people are calling us, nobody calls because they feel like it. Everybody who calls really needs help, and they're not doing it by choice. They're doing it because something's happened. Somebody's, in hospital, they're in a rehab, they've fallen down, or there's just, first signs of dementia, and the family is under stress, duress, and they really kind of need help. So that's something that we deal with day in, day out. We have 2 offices, one in Washington, D.C. and another in Rockville, that covers Montgomery County and all of Washington, D.C. And then we have another office that covers all of the larger part of Maryland, in Anne Arundel and Howard County. So our focus is on being able to understand your requirements. We come out and we, talk to the family. We meet in person, and that's very important to us because when we meet in person, we don't charge for that. We come out and we just talk to the family to understand really, A, that we can do what is needed, B, to understand the environment, and really C, to kind of, it's very important to us that we try to, really send the right person. And we really spend quite a lot of effort kind of matching the right person. I know that sounds very standardized, but believe me, it's if we didn't do that, we would fail 9 out of 10 times. So I think what's on the slide right now, which everyone can see, are our standard, areas of support. They're pretty much self-explanatory, but really, who is our client? Is a family or anyone who's looking to help loved ones. Something important to understand is the goal of service at Home Instead is to supplement a loved one. It's We have so many clients that have children that come in. They don't live in DC. They don't live in Maryland or Virginia. They're in a different state, and they basically come in, or they live 2 hours away, and they simply cannot provide the help that their parents or loved one needs, and they're relying on us to really provide that service, supplement them being on the ground. And that's something we take very, very seriously. When somebody entrusts you with a loved one, it's not a simple check mark exercise and you kind of do the sweet talk and you kind of then just, not follow through. We do what it says on the tin. When we give you a commitment that we are going to actually do these things, then we follow through. And that is something that is very personally important to me because I've been through it, the whole thing. With that, I'm going to hand it over to my very capable colleague, Pam, and she's going to talk a little bit more about some of the things that we do. Thanks, Pam.
Thanks, Imran. And thank you everybody for being here. And thank you to all the home care companies. We are all in this together. There are many people that are out there that need help. And I have been with Home Instead for 14 years. I've been in the geriatric industry for 30 years. I've been in long-term care and rehab. I have been in assisted living as well. But just a little bit, Imran, he went over the portion that is so important to us and the type of care that we provide, and you can see on the screen the type of services that we have, but it also comes down to our care staff and the care staff that we have. Being with Home Instead for 14 years, we have, and everybody, I know everybody says this, we have amazing care staff, but we truly do, and we're very conscientious of who we hire, how we hire. We vet our care staff. All of our care staff are they're all our employees, which is important to us. When they come on board with us, we look for experience. We do a national background check. We do a vehicular background check because we do transportation. And then they come through an initial in-person 2-day of training with us as well. So it's those types of things that are just very important to us, because if it wasn't for our care staff, none of us would have a business here. So it's important to hire the right people. And when people come on board with us as a client, it's important to make that match with them. And I know everybody here will agree with me 100%. You have to have the caregiver that has the right skill set for that client. So it's almost a matchmaking type of situation, and we take that very seriously. The whole team works together. We have HR, we have recruiting, we have client services, we have our home care consultants that meet with the families, and we all come together to collaborate to make sure who we're sending out to that person has the skill set that's needed for that client. So I just wanted to make sure that we highlighted that. I know, Frank, you asked a couple of questions. You had a couple of things in there that we needed to address. So I just want to make sure that we do that as well. We do provide personal care. We provide companionship, Alzheimer's and dementia care, hospice support care. We do provide transportation as well within those services. So all of our care staff are able to run errands, take someone to the doctor's appointments, go into the appointments with them, make those notes, bring that back to the family. We have an incredible client services team. I actually just saw a question pop up. What if the family doesn't live with the person needing care? We have many clients like that. So that person that's not living there, but maybe in charge or part of that care plan, you are a very integral part of that care. So we're talking with you, we're meeting with you. If it may be remote, it may be virtual. If we come out to do a care consult and you can't be there, we will Zoom Teams you in. You'll be a part of it, and then ongoing, you'll be a part of that. Giving us information, and we're giving you information about what may be going on with your family member. And it's a team approach. It's not just a team approach in the office and with our care staff, it's a team approach with the family. So it's very important.
Interject one thing, and something that's really important to me personally is, how Pam obviously has mentioned, the type of care staff that we hire, but really I think, and this is very common, and the other agencies here would acknowledge this, that a lot of caregivers tend to kind of, move quite frequently from company to company. And something we're very proud of, because we've been working on it for years, really, to build up a program of benefits that really helps us retain our staff and our culture. And so half of our entire caregiving group has been with the company for more than 5 years.
He stole my thunder. I was gonna say that.
Great. Thank you so much. I just want to remind folks that we are going to be taking questions at the end. So please put them in the chat. I will be facilitating at the very end of the meeting today. But we do need to wrap up and go to our next presenter.
Thank you, Frank, so much. And thank you, everyone.
Thanks so much. Thanks.
Great. And next up, we have Erica Chavez from Smith Life Home Care. So Erica, if you can unmute.
Hi, good evening. Thank you so much, Frank, for this opportunity, and also Cleveland and Woodley Park Village for allowing us to present our services. So my name is Erica Chavez. I'm the Director of Community Relations for Smith Life Home Care. A little bit about me. I have had the privilege of working with the senior community for the past 10 years. It all began in New Jersey, where I started with a nonprofit organization called Jewish Family Services with the older adult department. 7 years ago, I moved to Maryland, and I continued my work with 2 other home care agencies. And for the past 2 years, Smith Life Home Care has been my house. So despite my professional experience, my most meaningful and relevant experience has been caring for my own parents. It is truly a blessing to have them still alive with me at 89 years old, living comfortable at their own home, so aging in place. So that's a little bit about me. So now about the Smith Life Home Care. So Smith Life Home Care is a trusted partner with Charles E. Smith Life Communities. Many of you would know us better as Hebrew Home. So for over 25 years, we've been dedicated to providing high quality caregivers, whatever you call it, home, private home, nursing homes, assisted living facilities, memory care, rehab centers, hospitals, and other healthcare settings. We are proud to be top-rated provider for in-home senior care services for Montgomery County and Washington, D.C. Our team consists over of 400 certified professionals, including nurse assistants, home health aides, medical technicians, geriatric nurse assistants, and LPNs. All our staff members are truly vetted, bonded, and insurance, and ready to assist with a range of needs. We are ensured that the best client is provided for our clients. All our caregivers are COVID-19 vaccinated, and they have to have a previous experience of a year minimum working one-on-one with a client or on a facility. So our services, including personal care, health nutrition, toileting, mobility, companion and transportation, light housework, mobility, and also we provide services to all our houses: Greenhouse, Lando House, Revit's House, and Hebrew Home. So we have a special program on Friendship Heights, which we have an office. We have 4 caregivers on house to provide services over there. We start services at 1 hour, 2 hours, 3 hours during anytime during the day. So we also care for Alzheimer's and dementia clients. We have a specialized caregiver for those with memory challenges. We have also packages for post-surgical care. One of the short packages is Home and Settle. As you can see on the screen, it's 160 hours, really affordable. 5 hours of a caregiver, is including transportation. We have a second package that is Transition to Home. That one is 525, 18 hours of care after a procedure like knee replacement, those kind of things. You can use those 18 hours straight, or you can divide it 6 hours per day. So all our caregivers, because our affiliation to a Jewish organization, all our caregivers are instructed on kosher procedures. Also, because of the same affiliation and being a non-profit organization, we can keep affordable prices. Our services start at $28.95 per hour. We can provide 2, 4, 5 hours and 3 days per week. So we have one flat rate, no overtime, or different price for overnight or weekend services. So the first day of the services, we have a registered nurse to go to the client's house and do an assessment that's completely free. It's part of the full package that we offer to our clients. We also have another package that is medication management. That's provided by the registered nurse. The registered nurse will go to the client's house, make sure that organize the medication, everything is on place, and the visit is $149.95. That could be done every 3 weeks. We can do that in DC and also in Montgomery County. Even though that we are a private care, we accept all long-term care insurance. So at this point, you're asking why choose Smith Life Home Care. So for us, we are dedicated to ensuring that you or your loved one receives a tailored attention, emotional support, and companionship. For us, each client is particular. They need to have their own care plan. We make sure that we find the right caregiver that match the necessities of the client. The first day of the services, all my marketers and even myself, we go to the client's house to make sure that everything is correct, that we have a good start. So whatever you're recovering from hospital, undergoing rehabilitation, or choosing to age in place, our team, including certified dementia practitioners, senior home safety specialists, and of life specialists and registered nurses, ensures top quality care. So we are so proud that the Smith Life Home Care is licensed, bonded, and insurance in Maryland and Washington, D.C. We have A+ rating from Better Business Bureau, dementia-friendly staff, SageCare Platinum certification. We can staff cases in 24 hours or less. We have numerous accolades, including the Best Home Care Agency Award from Washington Jewish Week. We have 4 locations. Our principal location is at Deco Bam. It's across of the Hebrew Home. So 2nd floor. We also have another office at the Rain House. We have the Friendship Heights office and also Washington, D.C. So our mission is to empower elderly members of our community to maintain their independence and enjoy a higher quality of life. We have 24 hours communication. We never, ever leave a case without the staffing. Rains, snow, whatever it happens, we always provide a caregiver for our clients. For us, we understand that maintaining the dignity and independence while aging in place can be difficult and challenging. That's why we have our personalized approach, and we ensure that every client receives the essential medical support, emotional care, companion. We also have our own resource referral list that we can give that information to the families, the PCs, and the clients, so they can have the best support and the comfort to stay in their own home. So
Great. Thank you so much, Erica. Really
you.
appreciate that. Great. Next, we're going to move to Marla Lahat from Home Care Partners. Thank you so much, Marla. Oh, you have to unmute.
Here. Okay, great. Thank you. Thank you for being here. It's wonderful to share this time with you. I'm going to tell you a little bit about Home Care Partners and some of the programs we offer. This presentation is probably going to be a little bit different than some of the other agencies, and you'll see why in a moment. But Home Care Partners has been in business since 1957. We are a nonprofit 501c3 organization, which means we do not have any ownership. Any profits go right back into the business, often to support our home health aides, who are really, as everybody has said, they are the backbone of our business. We are Joint Commission accredited, which is one of the premier standard setting organizations in healthcare. We are licensed as a home care agency in DC, Maryland, and Virginia. We do provide services in DC, Arlington, Montgomery, and Prince George's. All of the services we provide are under contracts and grants with the local governments, Aging and Disability Services, or the Department of Aging, and in DC also with the Veterans Administration. As a result, our clients generally do not pay for their services, or they pay very little for the services. We are not a Medicaid provider, and we're not a Medicare provider. So we're really serving those who are in that in-between area where they would have difficulty paying for the service on their own if they had to do so, but their income is not at the point where they can qualify for Medicaid. Next slide, please. So in DC, I focus this primarily on DC. We have 2 home care programs for DC residents. One is through the DC Department of Aging and Community Living. They are our primary funder. It is the Homemaker program for DC residents who are 60 and over. Anybody can make a referral. We generally provide services 3 to 15 hours per week. That's not per day, that's per week. Usually our visits are about 3 hours in length. And the client, we call them clients, must need some help with either personal care or homemaking services because of their health condition or age or other frailty. There is no cost, but contributions are encouraged. Now, here is the part that I always hesitate to say, but right now, because our funding is really maxed out, we cannot accept new clients. I do hope that come the fall in October, it will be a new fiscal year for us, that we may be able to again accept new clients to this program. We also have our Veterans Administration home care program in DC that's only for vets that are referred through the Veterans Administration. The vets don't pay anything for the service. Generally, services provided 10 to 20 hours per week. Okay, next slide, please. So I couldn't take this opportunity without telling you about some of our other programs in DC where we can accept new clients. One is the DC Caregivers Institute. It is a wonderful program to support family members who are caring for an older loved one or an adult with a disability. Both the family caregiver plus the individual receiving care need to be DC residents, but they do not have to live together. There is no cost or income requirements, and we can do some really great stuff. We can reimburse for health-related purchases. We can set up respite care. We actually use a couple of the agencies that will be presenting today, and we can pay for it. It's a limited service, but at least it's another way that family members can get home care for their loved one. And we are accepting new referrals. Then we have our Safe at Home program. Some of you may know about this program. It is a phenomenal program in which we can do home modifications up to $7,000 per person. The income requirements are very generous. We can accept new referrals into this program, but we will not be, at this point in the year, we will not be starting new projects until October. But that program is open. It really can make it possible for somebody to stay in their home and then take advantage of all these other wonderful home care agencies, because the resident of the home is now in a much safer place. And then I want to mention quickly our Safe at Home 2.0 program, which is fairly new. It's an extension of our Safe at Home 1.0 program, but this program offers exercise and balance classes. They're all evidence-based classes to reduce the risk of falls. The classes are provided at various locations throughout DC, all the wellness centers and other in-person locations, but we also have a virtual class, and we have virtual classes starting on a rolling basis, and I really, really encourage it. They're fabulous classes, and the people that have taken them really feel it has made a difference and help them to be safer in their home as well. So I have the numbers on this screen, but you don't have to worry about that. You can call me, you can call Home Care Partners. We'll get you connected with the proper services.
Great. Thank you so much, Marla. And thank you for presenting on all the things that Home Care Partners does, an important partner with us in the villages. So thank you. Next, I'd like to now move to Jennifer Fitzgerald from Georgetown Home Care. Jennifer, if you can just unmute.
Hi. Yep, you can hear me now? Hi, everyone. Yeah, just a little bit about Georgetown Home Care. We've been in business for a little bit more than 12 years, and we are a mom and pop company. We were founded by John Bradshaw and his wife, Angie, and they're very much involved in the business, in there every day. And this is our team, the picture on the screen. And our mission and our passion is to help people age in place. So we, one of the things we do pretty much all of the same services the other agencies have spoken about. Everything from companion care to respite, personal care. We'll be there for hospice care. You know, we can be there around the clock. We do live-ins, so we can have a caregiver move in and take care of a client. We can, if someone's having to come home from the hospital or a skilled facility and they need 24-hour care, we'll do 2 back-to-back 12-hour shifts to make sure there's always coverage. But we can also do as little as 4-hour shifts. So if you're just needing 4 hours 2 or 3 times a week, we can do that as well. So it really, we like to make a plan based on what you need, and that plan can absolutely change over time. I have clients who started out just a few hours a day, and then they've moved on to more because they needed it or they saw the value in it. Our caregivers are extremely passionate about what they do. They're very good at what they do. I think sometimes it can be a difficult job, and they're excellent at it. If the first time we bring someone in and you don't think it's a great fit, we will get somebody else in. We can have you interview them in advance if you'd like to meet them in advance. A little bit about our rates. I know I'm going fast. I'm trying to get everything in. Our rates are between $33 and $37 an hour, and that depends on the length of the shift. So if it's a longer shift, it's a little less. And if it's a shorter shift, it's a little bit more per hour. But that gives you a range. One of the things I think that differentiates us is that we have a very quick turnaround. So if someone is coming home from the hospital or a rehab facility, if all of a sudden someone's going out of town and they need immediate coverage, we can fill those shifts. We are really good at it. We have a great scheduling team, and we have a lot of caregivers. So that's one of the things that I think is excellent, is you call us in the last minute if you need us, and we can be there. Other thing I wanted to say is, let's see, and we will definitely work with long-term care. So if you have long-term care insurance, we can submit those invoices for you and help you get paid if that's something that you've qualified for. We don't work with regular insurance, much like the other private duty agencies. But if you have long-term care and you've set that up through your insurance company, we can help facilitate that. The other thing I wanted to say is we don't have any long-term contracts, meaning if you sign up with us, it doesn't have to be for a certain length of time. It can be a shorter thing. And also we have a 24-hour notice. So it's not like a 2-week cancellation. If all of a sudden you don't need care because you're going out of town or something, we just ask for 24 hours notice and we can cancel that and then start it back up when you're back in town. So my job as a community relations director, there's 3 of us who do what I do at our company, and we're very involved with the families. So we meet you at the first visit. That's a complimentary visit. Find out everything that's needed. Sometimes we're meeting with family members. Sometimes we're meeting with the client. Sometimes both. And we're there the entire way as you need us. So I give out my cell phone. I have 2 colleagues, Catherine and Laura, who many of you know and have worked with. And if you need something, you let us know. We are just a phone call or text away. We're very involved with following up with the families and making sure that they're happy with the care they're getting and that everything is going well. We do dementia, Alzheimer's. It's literally everything from coming to the home and just being a companion, getting someone out to an appointment, all the way to 24-hour care. So like I said, we will specialize and make a schedule with whatever works for you. And I think that is it. I tried to go fast.
Great. Thank you so much, Jennifer. And again,
Sure.
please put your questions in the chat and we will get to those very, very soon here. Next up is Denise Dagdagan from Ingleside at Home.
Good evening, everybody. My name is Denise. I work with the Ingleside at Home team. We are part of the Ingleside group communities, the continuing care retirement communities that are located in Washington, D.C., Rockville, Maryland, and Lake Ridge or Woodbridge, Virginia. We're a little different from my colleagues here. We do the home care. We're the home care division, but most of our clients reside inside the Ingleside communities. We do provide services for those outside of the community or those that are also looking to move into our Ingleside communities. We are also a non-for-profit. So just like my other colleagues, everything that we make comes back into our caregivers, into our business, just to continue growing. Similar to everyone else, we provide the personal care, the companion care, assisting them going into doctor's appointments or other appointments that they may have. Sometimes it's even just to go to a museum or go shopping, run errands. Our team does not drive, but we can certainly set up an Uber or a Lyft ride with you. We can help coordinate that, or if that's something that you're able to do on your own or a family member can do, we can go with you. Our caregivers can go with you. We also provide services. We customize it. So not everybody needs the same thing, obviously. So it can be anything from, it's a 4-hour minimum outside of our communities. If you do live within our community walls, it's 2-hour minimums, but outside it would be 4. And then we try our best to keep the same caregivers to keep that constant and continuation of care. We like to say that we customize it based off of what you're looking for and what you're needing. So like I was saying, not everybody needs a shower every day, or they're looking for the specific same ADLs. It's not a checklist of things that you need to do. We really try to customize it to what it is you're looking for. Next slide, please. We are also a 24-hour, 7 days a week. We can do 4-hour minimums up to 24 hours of care. We don't do live-in, but we can provide 24 hours of care. Our offices, we have an office in DC. Ingleside at Rock Creek is over off of Military Road Northwest. But our Rockville location in Maryland, and then again, our Woodbridge office. The office itself is open from 8 a.m. to 4:30 p.m., but we do have an after hours team that can answer calls, non-emergency calls. So if there's an immediate need for a care, we can certainly set that up. You can call the after hours number for that. We also help in submitting to your long-term care insurance. Most long-term care insurances do cover our services, which is home care. We are not Medicare or Medicaid covered, but we do work with your long-term care insurance. We can submit them for you along with any of the requirements that they may have, such as notes, care notes, assessment notes from our nurses. What we typically see on our end is family members that are looking for that support because they're not able to come in and help their parents get that care that they're looking for. So we're that in between. Our continuing care retirement communities, again, we have our own assisted living and our skilled nursing areas, but we're the in between, just right before they're ready to go to assisted living or right before they need to go to a skilled nursing for long-term care. Our team steps in to help you stay independent in your own home. We also, as part of Ingleside, we also have a service that we call Experience by Ingleside. So if it's not something that Ingleside at Home can provide as a service, we can certainly connect you with what we call our concierge team, and they can connect you with a service that you're looking for: housekeeping, landscaping, drivers, those kinds of things. We would connect you with a concierge to find a vetted service already that we've worked with in the past. And then as far as rates, we range from anything, depending on, again, it's customized. So it depends on what it is you're looking for and how many hours. So it can range from anything between $35 to $40 an hour. Our caregivers are home health aides licensed in DC. And we also have an RN that will also come in and to do those initial assessments and reassessments every 90 days, or where there's a change in status. And that's it pretty much for Ingleside at Home.
Great. Thank you so much, Denise. We appreciate you being here. Next up is Susan Beasley with Montcordia.
Thank you,
so much.
Frank. Yeah, nice to be here. Thank you. The Montcordia, we are a 501c3 nonprofit, and we are under an umbrella called Service Coordination Inc. Service Coordination Inc. was established in 1982 as a nonprofit case management provider in the state of Maryland, and it's servicing people with intellectual and developmental disabilities. And SCI started expanding and wanted to market a broad reach to impact the aging population, and Montcordia was established. So it's a nonprofit, so our mission is very mission driven. So everything that even though Montcordia is profit, all the proceeds go back into the company, and then also doesn't go into line shareholder pockets, but it goes back to the business for the nonprofit company, and then also goes to individuals who can't afford services. So it's like pro bono. There are two departments within Moncordia. There's companion department and there's aging life care management. So the companion department is department that's highly vetted for professional individuals who come to that to service our clients. They come from backgrounds of being lawyers, nurses, OTs actually. We have PhD students and also masters in social work. So our companions come in very, very passionate about the elderly. And so we vet them and also screen them in a scope of making sure that they have the background that we need to service our clients. They are then matched with our clients very, very, appropriately. So if we have, example, if we have a client who's a lawyer, we match our client with a companion who's a lawyer. So the companions will have that personal interaction with them, and it's really for mental stimulation. So the main thing is companions are not personal care individuals. So we don't do the ADLs. It's really more about mental stimulation, engagement, and all our companions actually drive. So that's a huge plus. And also they are not contractors. So all of our companions are employees, and our rates go from 26 to 28 hours for our companions. The services for the companions is $17 an hour. And the reason why it's a little bit higher. Again, we really vet and actually find the appropriate match for our clients with the companions. And then we do the pre-screening. We do a free consult for that. So we make sure that we do the screening very well. And that companion is actually allocated to that particular client. And we don't do 4-hour minimum. We actually do 1-hour minimum. So that's a huge bonus on that part. We also have the other department, which is the aging life care management. And we also vet professionals on that regard. We have assisted living directors, we have memory care directors, we have nurses, we have OTs and PTs in this position. So we have the expertise. So the care management is a comprehensive approach that we do for our clients for navigating complexities of their changing as they progress in their journey. We identify appropriate resources, we provide medical navigation. If a client goes to the hospital, we step right in to help with navigating and making sure the clinical team is servicing our clients, rehab, such as a next level, in addition to when clients have to transition out of their home, the experts will ALCM, aging life care managers will step in and we'll help them navigate for the next level placement. We also help them provide specialty services. We do a lot of avocation. We bring in actually home health agencies and for supplement for companion care. We do 24-hour support. So again, if a client goes to the hospital, the aging life care managers and the companions are right there to service them. In collaboration, our departments work in conjunction. So they're well supported on both ends. So again, if the complexities for medical conditions change, the aging life care manager can step in. And if they need more social engagement, the companion care can work in conjunction with that. And if they need more services for the ADLs, we bring personal services in, so personal care. And the reason why we do all this in conjunction is to really support the clients so they can age in place, or they need supports where they transition out of the house. And so that's why we want to make sure that we all, collaborate as a team, make sure that the client is well supported, and that we really, really are there to support the family members. And a lot of them, as a lot of people noted tonight, they don't live locally. So we are the eyes and ears. And so we want to give them a peace of mind. Just to give a little bit of the cost for aging life care managers, we charge $2.18 an hour. But if we don't use it, if you guys don't use it an hour, we charge increments of 6 minutes. Our services, we do not charge for travel. So that's a huge plus, because I know that a lot of other care management groups would charge for everything to go from one destination to another. We don't charge for that. So it's just a flat of $2.18. We do charge time and a half on the weekends. But again, just to give you a peace of mind, we do provide 24-hour support. So even though 5 o'clock hits, we still have an on-call care manager to receive and, triage anything that's going on, and we react immediately. The best thing about the aging-led care managers and the companions is that we are trained. We train our staff with dementia training. Also, we handle a lot of psych admissions. We handle a dual diagnosis. So we're talking about, individuals' combative issues or behavioral issues or actions and expressions. We are very well trained in that and versed in it.
Great, thanks so
you.
much. Next, to round us out, and then we'll get to the questions which are in the chat. I am documenting those, and we will get there. We have Bola Cole and Dolores Athy Clearfield with us today. Is Dolores
Hi.
there as well? Great.
Hello, good evening. Thank you for having Capital City Nurses on this information session. We're happy to be here. I'm gonna give a brief overview, and I'm gonna turn it over to Dolores. I'm Bola. I'm the Regional Director of Business Development for Capital City Nurses. We are based in Chevy Chase, Maryland. We were actually owned for 42 years by Sue Rogers before she retired and we now are working with a company called Care Advantage, which is out of Richmond, Virginia. So I'm going to turn it over to Dolores, who will be able to break down and explain our services. Thank you.
Okay, so personal care is something that's been mentioned quite a bit by a lot of agencies. It's something that we have done successfully for almost 50 years. A couple differentiators for us is we are licensed, bonded, and insured. We do not employ any independent contractors. Everyone on our team, from our home health aides to our RN clinical directors, are licensed, certified, able to provide care, and are employees of the company. One of the things that we are very proud of is the fact that our clinical team is so heavy. We have RN clinical directors that are at each location, if not multiples, and they are assigned to a client as well as a client services coordinator. We know that this is a personal choice for families, and as you're navigating your journeys, it's helpful to have your point team that you can communicate freely with. There are changes, there are questions, and there's likes and dislikes. One of the things that we want to ensure is that nobody is with a caregiver that is not meshing well with them. So our RN clinical directors work directly with me as the continuum of care director, and each week we go through start of care visits, supervisory visits, incidentals, and we have the ability to walk through what good looks like and help our patient base stay in the least restrictive environment in the most cost-effective way. And by doing that, a lot of people ask, do you guys charge for continuum of care? Is this actually care management? And the answer is no. I am more of a fire extinguisher. We pull in services that are needed outside of our scope of practice with vetted partners to make sure that you can move forward in your care journey with confidence. So if you, for example, are in need of physical, occupational, or speech therapy, if you need skilled nursing, if there are chronic disease that you need some education around, we work with palliative companies. If someone is nearing end of life, we work with hospice. We provide service anywhere someone currently is calling home. So that could be in a travel situation. We have a lot of clients that travel to the beach for the summer. We meet people in rehabilitation centers and provide one-on-one care in hospitals, in personal homes, as well as within the community. We are dedicated to making sure that you can successfully navigate your journey with confidence. We offer hourly 4 hours to live-in care. Live-in for us is a per diem rate, daily rate versus hourly, which makes it more cost-effective for the families. We do operate on a 24/7 hour basis. We do have caregivers, care coordination, and emergency services available. So at any given time, you can call us if there's an issue with one of our caregivers. We are able to address it Children get sick in the middle of the night, cars break down, but we do have an on-call team that works on replacing to make sure that we do everything we can to ensure no one goes without care. We have transitional programs. We offer transportation. We can go to the next slide. And then one of the things that we do very well is that we maintain a roster of nurses, because a lot of the times when a family is receiving home health or skilled nursing services, Medicare does not allow for a continuation, even if you unfortunately don't feel comfortable. So we can do supplemental wound care. We can do catheter care. We can assist with medical devices, helping order DME, ostomy care, insulin, diabetic. Unfortunately, in the state of Virginia, Maryland, and DC, they do not allow caregivers to make medical determinations. So it is required for a nurse to be able to draw blood, to inject insulin, to measure glucose levels. Nursing assessments are included. We do IV antibiotics. And one of the great things about our continuum of care program is we want to make sure that you've exhausted all benefits eligible to you under your Part A and your Part B with your Medicare covered services. If you reach out to us for skilled nursing and there is a way for Medicare to cover this service, we will help you and ensure that you get those services in place. And then if we need to supplement, then we will talk about private pay options. So payers for us, we work with long-term care insurance, private pay, veteran benefits. We have community-based grants, Alzheimer's Association, veteran organizations. We work with families to figure out what works for you. We are, again, not contractual. We do a service agreement that outlines the days, the times, and then basically very similar to others, but we have a 24-hour notice. We need enough time to reach a caregiver to make sure they don't still show up. And we go through pretty much everything. We don't want to be invasive, but we want to be an extension of you. We want to be a supportive service to a lot of our clients do not have immediate family that lives near them. They don't, some are solo agers. So we find ourselves in a what if situation. It's happened and we're trying to navigate this on our own. So care navigation services are included in our hourly rate. No one pays for the nursing visits. No one pays for our clinical team or continuum of care to step in and help. And we on average are $32 to $37 an hour. What makes us great is our caregivers. Without them, we don't exist. We pay them very well. And we offer a 90-day review with up to a 20% increase based on client service satisfaction, being there, being attentive, showing up on time, ensuring you are taken well care of. And we do quarterly bonuses for them based on reviews from families. We have a caregiver connect night where all of our leadership calls our caregivers. How are you doing? What's going on? Is there anything that we can do to support you? Because we know if they are happy, clients and patients are happy, families are well taken care of, and we continue to do what we do best, which is provide care. So we appreciate you taking the time. I applaud everyone being here for the proactivity. I will say most of the patients that we work with are in a reactive status because something has happened that they did not expect. But you know, if it's proactive or if it's reactive, it really doesn't matter. We will be here to kind of wrap our arms around you, from our intake to our client services team to our clinical and continuum of care. We're happy to help in any way we can.
Great.
Next
Thank you so
slide.
much.
Last one, sorry. This
Okay,
is one of the most important things is, right, how do you reach us? So Bola is our regional business director of business development. She is your immediate point of contact. She is happy to meet you where you are. If we need to do a Zoom call with families to kind of align expectations or needs, we can do that. And then you can directly reach out to me if you need any collaboration from a continuum of care standpoint or resources within the community. We're happy to help. And then our client relations manager is Bree Howard. And it's just, we're a phone call away. Very easy.
Great. Thank you so much, Dolores. And thank you to everyone for presenting. At this point, we're going to do sort of Hollywood Square style here, and we'll all be on the screen. And I've noted your questions, and I think I'm going to start with a few that I know are to specific individuals. Pam, I think you answered this in the chat, but for the benefit for the viewers after this, since it's being recorded, if you could talk a little bit about what happens if somebody is aging solo, and with whom do you coordinate their care? You'll need to unmute, Pam.
I'm getting it. I'm getting it. So yeah, so somebody is aging solo. It's very important to have a family involvement, even if they're not, there face to face. So part of what we do in regards to that is always making sure that that person is involved. And if they have to be involved virtually, then that's what we do. We also, we provide quality assurance visits and calls to all of our clients. So they're set on a basis of 60 days, 30, 60, 90 days visits. So our client services team will schedule those meetings, go out and visit the families, just to have eyes on, making sure that everything looks like it should. It's important to go and visit these families or these clients that are living by themselves, to have eyesight on what's going on. Does everything look like it looked like when we first went out? Are there any issues going on? In addition to that, we are always in contact with our care staff. Any type of changes that may happen, they're calling us to let us know. We encourage the families to, when they're living solo, to let us go to those appointments, to let our care staff go and take them to those appointments so that we can go in with them, we can take notes, and we can bring that back to the families, because it needs to be a total collaboration, and the families need a peace of mind that what is happening, their families are cared for and that they're safe. And there are times that we get to the point where we're like, you know what, they're not safe in their home anymore, and we give that recommendation. And because we've been in the community for 30 years, we all have resources. We can help you to that next step. We're not going to keep someone in our care that's not appropriate. And it does happen, that we need to have that conversation about what's next. So we are here for everybody at every step of the way, 24/7. You can reach out to us, and we have our on-call coordinators that are after hours and on the weekends. In addition to that, we have a manager on duty with those on-call coordinators. So if something needs escalation, that person is there ready just to jump in and help out.
Great. Thank you so much, Pam.
Thanks, Frank.
The other direct question that came up is for Susan. If you could just clarify the $218 an hour, I believe that's for your care manager services. Are there, can you tell us about the rates for, companion care or other direct care providers, similar to for those helping with activities of daily living?
So Concordia, we don't do personal care, it's just companionship. So the companions, we charge $79 an hour. If you just want to have 1 hour, we do 1 hour minimum. We don't do 4 hours again. So if they just want to do 1 hour, it's $79, and then it's just a $36 charge for that for 1 hour. And then for care management, it's $218 an hour. But again, if we only see a client for half an hour, we charge increments of 6 minutes. So we will not charge you $218 if we didn't do a full hour. And again, we do not charge for mileage. We do not ask for a deposit. It's just a flat fee of $218. And again, if you don't use the 1 hour, we charge again of increments of 6 minutes.
Okay, great. And that's for a care manager, correct?
That's for care management, and the companion is $79 an hour. 1 hour minimum if you want. We do 24/7 if you need it. We've staffed some very complicated clients in memory care and assisted living who needed 24-hour coverage, and we're able to do that. But again, the companions it's not personal care. So we don't do any hands-on for ADLs. We don't do bathing, dressing, all that stuff. Our companions are solely vetted for the mental and engagement aspects for our clients. So again, if personal care, when the personal caregiver is there, they're doing all the ADLs, they sometimes supplement having companions so they can interact with the client in a different level for engagement. So they can take them out to the museum. One of our clients likes to go shopping. So she wants to go shopping. They hit all the boutiques. Another client loves to go down to the museum. So our companions are very versed in, the arts. So one of our companions takes one of their clients down to the museum. So we're really tailored to the specific of the interests and the hobbies of what our clients need.
Great, thank you. And then I want to throw this out to everyone. Some have covered this in the chat and some even in their presentations. But if you could speak to your employees versus contractors, and if any of the specific question in the chat was also about is it possible that a caregiver could be your employee as well as another agency's employee? Could someone be employed by two? And are they both considered employees? So if you could speak to that, and if anyone would like to speak to the cost of the rate at which you all pay your employees or contractors, you're invited to do that as well.
I'm happy to speak to that. So we offer only employees. With that being said, yes, they are employees of Capital City Nurses, but they do have an opportunity to work for multiple agencies. Our goal is to supply them with full-time work. They're in the event that their schedule does not allow, or we do not have a client that meets their availability around raising children or other things they have going on in their personal lives, they will work for multiple agencies looking for other work. One of the things that we have done over the years that we've done quite successfully is that we run PCA and HHA trainings. So we are able to bring caregivers in and certify them. So the staffing shortage for us, because we are corporately held, we do not have any franchise models. We have multiple offices and we have many caregivers that have compact licensures, so they can work in Virginia, Maryland, and DC. So we are able to pull caregivers from pretty much any location. The main goal is to match the caregiver with the family based on needs, based on personalities. But again, understanding that while we support them in their journeys, they have every right to work for multiple agencies. If we're not going to give them over 40 hours, but a sustainable wage for them is an 80-hour week, then they will work for two agencies. Caregiver pay starts out anywhere. I mean, if you look at minimum wage at this point, we're going up to $17.50, $18 an hour. So our caregivers are typically making anywhere from $18 to $25 an hour based on skill set, based on experience. And then, the remainder of the money covers insurances, liability, care coordination, registered nurses, and obviously office staff, because the state does not allow us to operate out of our homes, and I don't think we want to do that. So it's costly to run a care program. But you invest in your people and they invest in your clients, and that's what gives you success.
Great. Thank you,
I
Dolores.
just have to say, well said, Dolores. Yes.
Thank you.
I ditto what she said.
Yes.
I want to
Employees,
say
not contractors. Yes.
Yeah, I want to say probably our caregivers all probably work within these same individual industries right here, these home care agencies right here. I know I share some with Bola's team and some with Georgetown's team. So they're still W-2s for each one of us, though.
Mm-hmm.
Maybe this is a
We
good time
had one, we just celebrated 30 years with our company. Super excited. Yeah.
Awesome.
Maybe this is a good time to also address staff shortages, because we hear a lot about the challenges of home care agencies hiring staff, and I'm curious if you all have things you want to say about that particular challenge and how that's going, and if there's anything that other folks can do to help with that.
Marla, sorry.
I just wanted to jump in quickly. I know we have a wonderful group of home care agencies here, but really in the area, in the nation overall, there are huge staffing shortages when it comes to direct care workers, whether they are home health aides or CNAs, companions, PCAs, whatever they are called in each area. And so Home Care Partners actually is going to be hosting the DC Long-Term Care Coalition going forward. This is a group of advocates that are really working with the DC Council to try to make sure that this group of workers is recognized for their skills, that they're paid fairly. Even, you know, with the best pay, our aides start at $18.90 an hour. Most are making considerably more than that. That is not enough to live on in DC. Even as Dolores said, at 80 hours a week, it's still not enough to live on in DC. And it's a very challenging job. It's a very gratifying job, but a challenging one. But anybody that's on this call, I am happy to provide information afterward. But you can let your council people know. If you are a DC resident, let them know that this is important, that this group of workers is so necessary, and there is a huge shortage, and we need to be addressing it.
Yes. I'm going to concur with Marla. I ran a workforce development group for geriatrics in Anne Arundel County right before COVID hit. And it was obviously an issue then. COVID hit, it was really an issue for everybody. I think we're all kind of recovering. I can say for us, we lost at least half of our care staff during that time. And we finally have built back up. Thank goodness. I can knock on wood. I'll do that. But it was a challenge. You know, you have to hire quality people. You have to, you know, make sure that all your checks and everything is done before bringing that person on board. So while there is a shortage, I think for us, and I'm sure for everybody, we're on that recovery path, thank goodness. The colleges, workforce development in all the counties, I think have been very supportive in this field. And if everybody just taps into them, it'll just continue to grow.
Great, thank you. Another question was specifically to Capital City nurses. I'll let them answer first, and then I'll open it up to the others. If someone is in the hospital and unhappy with the nursing care that they're receiving, perhaps because there's also a nursing shortage, would you come into the hospital to help?
Oh, absolutely. That's one thing we actually specialize in, and even the timeliness of getting the caregiver in place once we receive that call from the hospital. So the one thing about the hospital is that the contract it's always a contract between our agency and the individual in the hospital, never a contract between the hospital and our agency. Okay. So what we do is that once the call comes in, we typically can get a caregiver in place at a hospital within 2 to 3 hours to stay with the potential client. We offer this service just about every day, or if not every week, of sending caregivers to the hospital to assist with care at the hospital. In rehabs, you do have to have a certain type of license, either a CNA license and paperwork to support the caregiver being in the rehab. So we are able to provide all of that information timely to the directors of those rehabs to make sure that our caregiver can enter the building and be signed in appropriately.
Right.
I was just going to follow up with that really quickly. We do the same, and it's not just aging at home. If someone is in assisted living, a skilled nursing facility, or a hospital, we can be there to care for them as well in that environment.
And I was going to just interject too, like Moncordia, our companions go in all the time in any institution. And also wanted to tell the prices for our companions. They're not contractors, they're employees, and they make between 26 to 28 hours, depending on, you know, high education. So they're very well taken care of. And we don't seem to have a shortage on that either. So we have a lot of applicants coming in.
Great, thank you. We also had a question about how can we get Medicare to help with end-of-life care? And is anyone working on this? Does anyone have any expertise they want to lend to this?
Call your representatives. And honestly, there are states that are out there that Medicare is covering cost for this. Maryland is behind on, and you can see I've got a little bit of a, I get very passionate about this, but it comes down to the state of Maryland and different policies and things we have in place. So it's just getting loud, getting out to your representatives and getting it here. The West Coast is very proactive in regards to Medicare and covering our types of in-home care services for families. It just hasn't happened here yet. So it needs to happen.
Yeah, and if I could add, a Medicare legislation several years ago implemented a program called the Personal Home Helper. And you can call if you're with a managed care organization or traditional Medicare, you can find out if your managed care is part of that program. It is 4 hours a day for 31 dates of service per year. What they did, unfortunately, is the managed carers incentivized people to take those policies based on that program and then had a special open enrollment period for you to enroll in it. So some people have it and are not aware, and some people find out very upsettingly that they missed that open enrollment period. But you can also, legislation is coming for change with Medicare. There are lobbyists constantly working on this. In DC, they did open the first Medicaid certified assisted living community, which is great. The residences of Kenilworth Park. But as far as Medicare coverage is, the only change coming for this year that I am aware of is that Medicare is now offering to reimburse family caregivers. So I don't have any details around that program yet. I'm happy to share it with you, Frank, to send out to your members when we do. But that is legislation that did pass and should be coming down the pike very shortly. But again, it's very hard to care for someone if you are not an experienced or licensed caregiver. And, you know, one of the things that makes home care so great is it allows family members to be family. The dynamic changes, and especially with end of life care, you don't want to be the task taker, you want to be the family. So we do support end of life patients all the time. And we do work very closely with several hospice agencies to be able to provide, you know, the bereavement support and put services in place. But as far as bedside vigil care, Medicare hasn't caught up yet, and I think it stinks.
Yes, please do share those resources with me, and I'll make sure that they get on our resources page, which is a good time for me to plug that. It's really easy to get to. You just go to our website at cwpv.org, and then you click on resources. And we really spend a lot of time with a great volunteer to organize those resources to be based on how one would search for that information. So I really invite you to look at that. We update it every single week. And it's great to have it there. I will also share that information with my colleagues across DC, so that whatever village you're in, hopefully you will get that information as well, as we are working much more collaboratively now with within DC villages. One last question that I want to make sure we covered is I believe everyone has now talked about who owns their organization or their agency. But if there are any other questions that remain there, if you could please let me know in the chat which organization may have omitted it. I believe we've covered everyone according to my watch, but perhaps not. And lastly, as we're doing that, I just want to open it up for any other last questions that people have. And I certainly want to thank all of you for being a part of this for the last hour and 20 minutes. But also to our panelists who spent a great deal of time putting this together and sort of running through this in a very quick fashion. Thank you so much. I really appreciate it. I'm not getting any other questions, so at this point, I'll go ahead and just move to close a little bit. I'd like to, again, thank everyone for coming. I want to, again, say that I really view everyone here as a resource. We're all part of the aging network of service providers, and we each play an important part. And so I'm really happy that we're coming together to figure out how we can help people to remain living independently as long as they possibly can. Again, this session will be on our website tomorrow at cwpv.org, and you just scroll down to the bottom, you'll see our blog. And I want to let you know that we will have a third and final segment to this webinar series. And the final segment will feature 2 or 3 members of the community of the Cleveland and Woodley Park area that have hired home care aides independently outside of an agency to assist them or their loved one, either full or part-time. And we'll explore with those individuals the pros and cons of going that route for in-home care assistance. That will be scheduled in late July or early August. Stay tuned to your newsletter. Our village newsletter comes out every Friday. I also share that information with all of the other villages, so it's likely that you'll get it in your village newsletter if that's where you got this information about this particular one. Again, thank you so much for being here tonight. It's always important to get this information so that you are prepared for when you need it. And that's really the whole point of this, to make sure that you have the resources that you need when you need them. It really allows you to be in control of making decisions for yourself. Thank you very much. I really appreciate it. And we will see you for segment 3 in late July or early August. Thanks so much, everyone. Good night.
Night.